So I first became involved with WPSR. Ooh, when was Target Seattle?
82.
82?
1982.
So let's start again.
Okay, wow, okay. Yeah, that's a long time
That's
ago.
a long time ago.
Yeah, okay. The way I got involved with starting the chapter in Washington is that I saw the advertisement from PSR in the New England Journal of Medicine, filled it out, sent it in, and almost simultaneously 3 Mile Island happened. Someone from Boston asked me to start a chapter. I called people who I knew, people who knew I knew. They began meeting at my house. I particularly remember with love and affection, Ira and Terry Callett. We continued to study low-level radiation until Helen Caldecott came out here. Our chapter took off like a mushroom, and we began studying nuclear war, medical consequences of nuclear war, and did our first huge public event in 1981.
The April 1981 Symposium on the Medical Consequences of Nuclear Weapons and Nuclear War featured a who's who of world-famous medical and other experts from around the country. It really put WPSR on the map. We had CME credits, we easily sold out 1,200-seat Meany Hall. Over 100 members of the press attended, and once there, they were stunned by what they heard. And the next day, there was national news coverage and horrified, almost apocalyptic headlines in every paper in the West. Our membership skyrocketed, and the symposium set the stage for Target Seattle's even broader dialogue the next year.
Well, Target Seattle was an idea that I think both Judy Lipton and I hatched. Judy said, let's have a gathering in Seattle to bring everybody together to discuss how to prevent nuclear war. It was a week-long symposium in 1982, bringing together citizens from Seattle as well as experts from around the country, discussing how to prevent nuclear war, and ended with a citizen celebration at the Kingdom with 20,000 people.
It was a heady time. We were part of an international movement fighting against the arms race and against the deployment of nuclear weapons. In those early years, I think it was 1983, Pete McGuff and Bill Donnelly and I put together a class on the nuclear arms race for experimental college. It covered what we call the traditional bombing runs, sort of what would happen if a 1 kiloton nuclear weapon was dropped on Seattle.
Presentations were given all over the King County area and beyond. Many of us would go out as individuals and talk to small groups in living rooms or in schools. Churches were really open to us at that time. But in this, I think one of the things that was most powerful were individuals speaking with their neighbors and others in the community about these risks. I think what was most impressive at that time was the community activism.
The thing I really enjoyed about working at WPSR was to be rubbing shoulders with these medical professionals who work really hard all day long to help their patients to have good health. And then with whatever spare time and energy they have, they plow that right into really big, important issues like children's environmental health and preventing gun violence and, of course, preventing a nuclear war.
The health perspective was really crucial in the success of some of these campaigns, like eliminating toxic flame retardants was a really crucial campaign, and having physicians and other health professionals talk about the impacts that the toxins have on brain development and on health. One thing I have really liked about the Particles on the Wall exhibit is the way it brings together, I feel like, core issues of WPSR. It really examines the atomic bombings and the aftermath of that, including the plutonium production in Hanford and the toll that's taken, but also the toll, of the bombings and the continued threat. And that it does it in a way that lures people in, I think, with the visual art, and then presents them with science and history and poetry.
Cops and Docs was born from a meeting that I had with the wife of the Seattle Chief of Police, Norm Stamper. And we were both concerned about the epidemic of gun violence, particularly among young people in Seattle back in the early 1990s. A Seattle police officer and a Washington PSR physician would go into junior high school classrooms. We wanted each one of those kids to think what they would do if suddenly confronted by a situation involving a gun.
So you have to ask yourself, what can citizens in a place like Washington State really do about a big, vast international problem like what goes on in Israel, Gaza, the West Bank, and Iraq? Well, Jerry Haynes, tip of the hat to Jerry Haynes.
We have overall, probably between 30 and 40 trips into the Middle East since 1993. And we've traveled to Israel, to Palestine, to Jordan, to Syria, and 5 times into Iraq. So WPSR has been very active in looking at what's going on in the Middle East. And then since 2009, we have fielded 14 or 15 medical service trips, primarily in Gaza, because that need there was so profound.
About 5 years ago, we narrowed our focus to 3 programs, all major threats to the health of the broader human community. Of course, nuclear weapons, that's been our issue from the beginning. A warming planet, which is equally threatening to the human condition, and economic inequity, given the fact that there's a huge connection between widening economic inequity and poor health.
I think the current work that we're doing right now with Congress is probably the most effective work that we have done in relation to changing policy. The whole notion of assured, mutual assured destruction is what underlies deterrence, and it's our human future teetering on a knife edge of possibility. I got involved as a child psychiatrist because I love working with people, and I work intensively, maybe with 500 people in the course of a 30-year career. A single small weapon takes out hundreds of thousands of people. It just completely undoes everything that I've stood for. It undoes all of the values that I stand for. So not standing up for this is betraying my own fundamental beliefs.
The efforts that have been made with climate change put WPSR in the front rank of local organizations in the state of Washington at accomplishing things.
So our climate program has really ramped up over the last 5 years. We were very successful with our partners in the Stand Up to Oil Coalition in preventing new fossil fuel infrastructure in our state since we joined. Things got really exciting when we joined the 1631 campaign. Our volunteers were key in the signature gathering and the canvassing process. We also did public testimony, wrote op-eds, became pretty visible. What was most exciting about that campaign was the ability to draw in other healthcare professional organizations, public health and hospital groups to get behind us and actually support 1631. And we're really hoping for their endorsements of climate action going forward.
So I think that this organization is at a very important moment, and I think that it would be time for us to use the energies that we have and the intellect and the capacity of the members. I would encourage everybody to take an active role, become part of this organization actively, and help us conquer this bad issue of the risk of nuclear war and also the challenges of climate change.